What's going on?
We just worried about our assignment.
Oh, really? So, what's your assignment about?
Lately, tuberculosis cases is increasing. I would like to do some research on it.
Oh, why don't you watch this video? Maybe it might help you to get an idea.
Assalamualaikum, hello everyone, I'm Humaira. In this video, my friend and I are going to explain to you about tuberculosis or TB is a dangerous and infectious disease caused by a bacterium called Microbiology tuberculosis. It usually attacks the lungs but can also affect other body parts. TB is hard to tackle mainly because it spreads through the air. When a person with active TB disease in their lungs coughs or sneezes, the bacteria are released and can stay airborne for several hours. Those who breathe in the bacteria may then become infected. Thus, TB usually spreads to people who live or work closely with an untreated, infectious patient with active TB disease. Most people infected with the bacteria remain well but have latent TB infections. This is a condition where the TB bacteria are kept under control by the person's immune system. People with latent TB infection do not feel sick and do not spread the germs to others, but when the immune system cannot control the bacteria, the infection progresses to active TB disease. A healthy person who is infected has a 10% chance of developing active TB disease in their lifetime. The highest first period is within the first 2 years of being infected. A person with a weakened immune system has a higher chance of progressing to activate TB disease than people with normal immune systems. This can happen if you have certain illness, especially those with HIV infections, babies, and young children, or taking medication that suppresses the immune system.
Hello everyone, I'm Atika. So I'm gonna talk about the causes of tuberculosis. So what is causes of tuberculosis? Tuberculosis is caused by bacterium Mycobacterium tuberculosis. It can spread through close contact with people who have active TB. When someone with active TB coughs, they release small droplets that containing a bacteria. You can catch TB if you regularly breathe in this droplet over long period of time. Some people have TB in their body but do not get ill or have any symptoms. This type of TB cannot be spread to others, but it can turn into active TB in the future. Next, people who are more likely to get TB is actually anyone can get TB, but some people are more likely to get it or get more seriously ill from it, including people who, number one, is spend a lot of time with people who has active TB, just as people living in the same house. Second one is people that live in overcrowded or unhealthy conditions, such as people who are homeless. And the third one is people who had TB before and it was not treated properly. So that's all the causes of tuberculosis.
Hi, I'm Elia. I will explain about the symptoms of TB. First, fever. Fever is general symptoms of TB and occurs when the bacteria enter your body after being exposed to someone who has it. Fever will getting worse at night and also comes in combination with sweating. The second symptom is loss weight. It happens because the body uses a lot of energy to fight the infection in the lungs. That means the energy cannot be stored in the body to gain weight and stay healthy. The patient will suffer from poor nutrition that can lead to reduction in appetite. For the third symptom is night sweat. Sweating profusely at night indicates that the level of infection in the body is potentially very high. It is because the body temperature is higher than 37.8 Celsius. So if you wanna know more about the symptoms of TB, stay tuned cause we're gonna explain to you in details.
Hello, I'm Shafinas. I will continue about the other symptom. Symptoms of tuberculosis usually come on gradually. So here are common symptoms. First, you will cough continuously. This is because this disease is focused on the organ of the respiratory system, the lung, which function to exchange oxygen from the air with carbon dioxide from the blood with the help of hemoglobin. Next, chest pain or shortness of breath. This is related to my first one, which is cough. When coughing continuously can cause chest pain. In addition, this disease also makes the body easily feel tired and leg numb. In any case, when you have this sign, quickly follow up with treatment, even if it is not TB disease.
Hi, my name is Nurhani and I'm gonna share with you about mode of transmission of tuberculosis. Microbacterium tuberculosis is carried in airborne particles that called droplet nucleus size of 1 to 5 microns in diameter. Infection droplet nuclei are generated when a person who have pulmonary or laryngeal TB disease cough, sneeze, shout, or sing, but depending on the environment, this tiny particle can remain suspended in the air for several hours. Microbacterium tuberculosis is transmitted through the air, not by the surface contact, so the disease is not spread by the holding hands with someone who is infected or by using same tableware. So, the transmission occurs when a person inhales droplet nuclei containing Microbacterium tuberculosis and the droplet nuclei transverse to the mouth or nasal passage, upper respiratory tract, and bronchi to reach the alveoli of the lungs. That is for me. Thank you.
Hi, my name is Azmanis Fidin binti Azmir. I'm going to talk about tuberculosis prevention. Bacillus guerin is a live vaccine against tuberculosis. The vaccine is prepared from strain of weakened bovine tuberculosis bacillus called Mycobacterium bovis. It is 80% more effective in preventing TB for 15 years. Moreover, the person with infectious tuberculosis can infect up to 10 to 15 people per year. But once they diagnosed with TB and started on treatment, the majority of patients are no longer infectious. As TB is an airborne infection, it can be reduced by a few precautions such as good ventilation, natural light which will kill off the bacteria, and good hygiene to reduce the spread of bacteria. That's all from me.
Hi guys, I'm Balkis. Now I'm gonna add another tip to help prevent others from getting TB during your first few weeks of treatment. Do you know a healthy immune system is the best for defense against TB? 60% of adults with healthy immune system can kill TB bacteria. First, take all of your medicine as they are prescribed until your doctor takes you off them. Second, keep all your doctor appointments. Third, always cover your mouth with tissue when you cough or sneeze. seal the tissue in a plastic bag, then throw it away. Third, wash your hands after coughing and sneezing. Another than that, you need to stay at home from work, school, or another public place. Use a fan or open window to move around fresh air. And lastly, don't use public transportation.
Hi, my name is Haifa. Now I want to talk about a few treatments of tuberculosis disease. Tuberculosis disease is treated with antibiotics. Treatment is recommended for both TB infection and disease. If you have a latent TB infection, you might need to take only one or two types of drugs. Active TB disease requires taking several drugs. Common medications used to treat tuberculosis include isoniazid, rifampin, rifabutin, and rifapentine. First, isoniazid, also known as isonicotinic acid hydrozide, is an antibiotic used for the treatment of tuberculosis. Next, rifampin is a common medicine used to treat LTBI. It kills the sleeping TB germs before they make you sick. Last, rifampentine, sold under the brand name Briftin, is an antibiotic used in the treatment of tuberculosis. In active tuberculosis, it is used together with other anti-tuberculosis medications. Most people can take TB drugs without serious side effects. If you have serious side effects, your care provider may ask you to stop taking a drug and you may have to change the dose of a drug. Talk to your healthcare provider if you experience any of the following, like dark urine, light color stool, yellowish skin or eye color, unexplained weight loss, unexplained tiredness, signs of depression, rash, and joint pain. Thank you.
Hi, I'm Khatijah. Now I'm going to share another treatment of tuberculosis. The first one is pyrazinamide. Pyrazinamide kills or stops the growth of certain bacteria that cause tuberculosis. It is used with other drugs to treat tuberculosis. This medication is sometimes prescribed for other uses. Pyrazinamide is a potent sterilizing agent that shortens the treatment duration needed to cure tuberculosis. It is synergistic with novel and existing drugs for tuberculosis. Pyrazinamide is a potent sterilizing agent against Mycobacterium tuberculosis. It is unique in its activity against semi-dormant bacilli in acidic environment and against bacilli that remain viable despite unfavorable local conditions and antibiotic pressure, so-called persisters, that must be eliminated to cure tuberculosis disease. The activity of pyrazinamide, a critical drug for tuberculosis treatment, in case as drug concentration go up. But optimizing this drug alone is unlikely to result in treatment shortening. Rather, rifampicin dosing must go up in parallel. Last but not least is ethambutol. Ethambutol eliminates certain bacteria that causes tuberculosis. It is used with other medicine to treat tuberculosis and to prevent you from giving the infection to others. Ethambutol comes as a tablet to take by a mouth. It usually is taken once a day in the morning. Ethambutol may cause side effects. It is loss of appetite, upset stomach, vomiting, numbness and tingling in the hand or feet. If you experience any of these following symptoms, blurred vision, inability to see the color red and green, sudden change in vision, skin rash, itching, you must call the doctor immediately. Don't forget it. Thank you.
Wow, such a nice video.
Yes, you can get a lot of information from this video.
Thank you, Venus. No problem.